Hello, friends. Dr. David Katz back with another COVID reality check during these strange and trying times. And frankly, I think one of the things that would be good for the COVID pandemic, not to mention everything else, would be a bit less stress in our lives. I wish there were something we could do about that. There's a lot that I could cover right now, and most of it I won't. So just passing reference to the fact that yes, case counts are up, but multiple reasons for that, including some false positives. We're finding more and more evidence that the PCR test done routinely can actually detect dead viral fragments and mistake that for an active infection when in fact it's an infection that happened and is now over. So if you add up infections that are over plus infections that are new, you get big numbers. If you test more, the numbers go up. But on the other hand, there are places where hospitals are filling up. What's going on there? And obviously that's real, but mostly we're seeing that in places that were not hard hit already by the pandemic. Places that were hard hit, there doesn't seem to be much shift in hospitalization. This time of year, hospitalization goes up in general. I'll come back to those topics, what's going on there. There's a lot to talk about. And then, of course, there's the vaccine issue with the announcement by Pfizer that they have good provisional evidence. And yes, it is good news, but yes, it is quite provisional evidence. I dug in as best I could, total of 90 cases out of 42,000 people, and what they found is in evidence in favor of protection 7 days following a second dose of vaccine. So in other words, people were injected twice, and within 7 days of the second or booster dose, there was a significant protection. Does it last? What happens if you only get one vaccine as opposed to two doses? And again, the infection rate in the entire cohort of 42,000 people, there were about 90 cases, so that's 0.2%. So, whether vaccinated or not, 998 people out of 1,000 weren't getting COVID. So, more to discuss on all of those topics. But we're going through this extremely difficult time in terms of fundamental issues of how democracy is supposed to work in America. And by the way, as I record this, it's Veterans Day, so just a quick shout out of thanks to any veterans watching this. I profoundly and deeply appreciate the many acts, great and small, that have defended justice and liberty and democracy, my right to participate in an election. So thank you for that, and I would say those efforts deserve better than the mess we have on our hands right now, and I hope we make good on the rights that have been protected for us by those of you who have served, so thank you. So what I want to focus on just in a couple of minutes in this particular episode, we now have a Biden COVID advisory group. I know many of the people on it. And so it's time to be thinking about what should America be doing now. This far into the pandemic, this much water under the bridge, what should we be doing now? And I think it's a pretty clear four-part story. And this pertains both to what the government can and should be doing on our behalf and what we need to take into our own hands. So first, everybody should know their level of risk. And that is possible by asking yourself a few simple questions. Are you overweight? Yes or no? Do you eat well? Yes or no? Are you physically active? Yes or no? Do you have any major chronic diseases? Yes or no? But you shouldn't have to do that. There should be a government website, essentially, that makes it effortless for you to answer a few questions and land in a color-coded grid where red is high risk, yellow is intermediate, green is low. And sure, we could be more granular than that. We could have shades of red and shades of yellow and shades of green. And you should know not only what your risk is, but what are the risk levels of people you care about, people you live with, your family, your loved ones, the people you interact with most intimately. What is the range of risk tiers in your daily mix? That should be information made available to every American, not rocket science. Colleagues and I have published a few papers looking at the prevalent risk factors. We know how much obesity contributes, diabetes, hypertension, heart disease. And no, these are not just things that if you have them, you're out of luck. If you improve the control of diabetes, high blood pressure, coronary disease, inflammation, diet quality, physical activity, if your weight is trending down rather than up. All of these things can make an almost immediate difference. So everybody should know their risk. 2, policies and practices should be issued in direct correspondence to risk tier. Again, it's time to move past the notion that one size fits all. It's not true with regard to the threat of the virus, and it's not true with regard to the protections of policies and personal behaviors. So we ought to be able to tell everybody loud and clear, based on your level of risk, here are the things you need to do. All right, so not everybody needs to shelter in place, but the highest risk, living in parts of the country where the virus is in wide circulation, or parts of the world, probably do. Is it safe to travel? Is it safe to convene with family? What about the holidays? Well, it depends on your level of risk. And it also depends on the way risk tiers are mixing. And one of the things that we all need to embrace, just as decent human beings, is that when we interact with other people, our behavior should always accommodate the highest risk person in the mix. That's just basic human decency. It's like helping an elderly, feeble person across a busy street, which every Boy Scout is supposed to do. It's just decent, right? So helping one another through the pandemic, basic human decency, and that means accommodating people with higher risk tiers. So everybody should know their risk. If we're getting together in groups, we should know whether or not they're high-risk people in the mix, and we should accommodate them. That's 2. 3, we need a national health promotion campaign. Now, it doesn't have to be national. It could be every state. It could be every business. It could be every family. Frankly, it should be all of those. But we should all be focused on optimizing our diet, physical activity, avoiding toxins, managing stress. Heaven help us with that one. Getting enough sleep, another difficult one. But in any event, these lifestyle practices that are the cornerstone of my 3 decades in medicine and public health, massive influence on the quality of our immune responses, massive influence on our vulnerability to adverse COVID outcomes. And we're an unhealthy nation. We were an unhealthy nation before the pandemic. We brought that burden of ill health into the pandemic, and it has proven to be a huge acute liability when it has been a chronic liability all along. It is time to get healthy America. So I would hope that the new COVID task force helps everyone to know their level of risk, develops guidelines where you can match recommended policies, practices, behaviors to your risk level and to a mix of risk tiers that may be part of your daily routine or your routine on a holiday or a special occasion, and where we start to develop a systematic approach to health promotion. I have all sorts of specific ideas about that. My career is devoted to it. I've written many books on the topic. I'm not going to provide all that information here now. I'll provide a link to my website. But again, everything we can do to help people eat better, be more active, manage their stress, on and on it goes, make as many of these critical assets freely, easily, routinely available to every American, do everything necessary to get these assets where they can do the most good. That's 3. So, just to summarize again, everybody should know what risk tier they're in. Everybody should have guidance that's tailored to their personal risk tier and that should account for a mix of risk tiers. And everybody should have the opportunity to engage in a national emergency response. Let's get healthy together. And then 4, I said there would be 4. 4 is let's be prudent while we're waiting for all of that. So, yeah, we ought to wear masks routinely. I've seen all sorts of debate about the utility of masks, but the simple fact is they don't need to be perfectly effective. They capture the moisture that basically is the vehicle that carries viral particles into the air from one of us to another. And an imperfect job is better than no job at all because it reduces dose. And there's lots of evidence to suggest that if you have partial immunity from exposure to a common cold coronavirus and are exposed to a small dose, you're less likely to get sick at all. And whether or not you have partial prior immunity to SARS-CoV-2, if you're exposed to a small dose and you get infected, the infection is apt to be much less severe than if you have a larger dose. Masks attenuate dose. Distancing attenuates dose. So let's be prudent. These are just prudent practices while we're getting through the pandemic. The other thing I can talk about, how close are we to the end? And again, many of these themes that I've addressed in prior videos, I'll do my best when when we're living through a less crazy, trying, exhausting period to come back and address all of these in turn. Right now, I would say, if anything, there's just too much information about all this, right? I mean, you need a machete to cut through it all. So let's just keep this simple. What can we do now that is clearly, obviously constructive? We should all know our level of risk. And by the way, I will, of course, attach some links to this video that help provide some information on that topic. But again, there should be an easy, national, interactive website where you enter a few tidbits of information and you find out which color-coded risk tier you're in. We should have guidance. It should be apolitical, it should be nonpartisan, it should be science-based guidance on the best policies, the best practices, the best behaviors matched to risk tier and the risk tier of other people you care about. We should all have the opportunity to engage in state-of-the-art health promotion behaviors that are made available to us by those who are addressing COVID. There is an acute case for chronic health now, and we should all practice the prudent behaviors of distancing and mask wearing so that whether we get exposed or not, those of us who haven't already, we're attenuating the dose, and they're more likely to contribute to those who get over this infection and never even knew it happened, as opposed to those who wind up being actually sick. Four-part response to what can we do right now that's obviously constructive. I'll be back when when the world allows and try and address some of these more contentious issues about where exactly are we in the pandemic. But no matter where we are in the pandemic and no matter where you are in the world, these four things clearly make sense. They align with the science. And since we have a new COVID task force, I'm hoping perhaps someone on it might see this too, and I hope they help us out. Let's risk stratify the nation, match our policies and guidance to risk tier, help everybody get to the lowest possible risk tier, and rely on simple, prudent practices while we're waiting for all of that to happen. Okay, everybody, stay safe, stay well, and be back to you soon.